Hello, my name is Dr. Phil Brotman, and today I want to speak to you about preventative medicine. Preventative medicine is going to be highly tested on Step 2 CK because it's so much easier to prevent a disease than to go through the treatment for a disease, right? By prevention, we can prevent a lot of disability and morbidity that patients experience once they're ill. Quality of life will be greatly improved if we can prevent disease instead of waiting for disease to help. There's a focus in medicine from switching for doctors being traditionally just treating people after the fact to being proactive and preventing illness. We're going to talk about cancer screening today. And cancer screening is part of the overall concept of preventative medicine, right? It's to maintain the health of the individuals and to prevent disease and promote their well-being. We need to look at the most common causes of death in the United States to determine what we're going to prevent. Certainly we think of cancer as the cancer screenings as the number one test that we screen for. Screening should certainly be something that is easy to do, safe, accurate, reliable, and we should generally screen for diseases where we have some treatment to offer the patient. Okay? But look, the number one cause of death in the United States is heart disease. So we better do some tests to screen for heart disease. All right? Stroke and heart disease both are atherosclerotic causes. So if we reduce diabetes and hypertension and obesity and stop smoking, we're going to lower the death rates in these categories. All right? The fourth leading cause of death, chronic lower respiratory diseases, well, that is another disease that's caused by smoking. So if we can eliminate smoking, we can greatly improve the quality of life for the population. What are some of the topics that we should discuss with our patients in order to promote a healthy lifestyle and a long and happy, productive life? Well, the first most important thing is smoking, which we'll cover separately. This is the single most important thing you can do to prolong your health, is to stop smoking. All right? Now, the second thing, which we'll cover now, is sun safety. Certainly skin cancer and melanoma are more common with exposure to the sun. So it is appropriate for the physician to counsel the patient to use hats with large brims and the liberal use of sunscreen, as well as when doing a physical exam on a patient to expose the entire surface of the skin and look for suspicious lesions. We're going to talk about weight today, because weight increases your chance, being obese increases your chance of colon cancer, breast cancer, endometrial cancer, esophageal cancer, as well as kidney cancer. Let alone that obesity gives you more wear and tear on your joints, predisposes you to gallbladder disease, as well as all the cardiovascular diseases and the increased incidence of diabetes in the obese population. So weight is a very important thing. We need to discuss with our patients exposure to chemicals. We know that asbestos is associated with lung cancer and mesothelioma, right? Benzene exposure is been related to leukemia, right? Radiation, we need to limit our patients' exposure to radiation. And one area of concern now is radon that accumulates in basements, is the second leading cause of lung cancer currently. Okay. Certain medications can be dangerous. For example, the discussion of estrogen causing endometrial CA. So endometrial CA needs to be screened for. And we need to be concerned about pollution. I'll just limit myself here to one little segment. We need to counsel our patients about the dangers of secondhand cigarette smoke. Secondhand smoke is dangerous and can cause cancer as well. Lastly, we need to be concerned about different infections that people can get. We know that the human papillomavirus causes cervical cancer. We know that HIV is associated with many cancers, including Kaposi's and lymphoma and Hodgkin's, right? Hepatitis infection, hepatitis B infection, causes cirrhosis and hepatocellular carcinoma. So by counseling our patients about prevention of infection, we are prolonging their life. Well, let's talk about smoking, since that is the most important thing that we can do to prolong patients' lives. It prevents many cancers and is a major risk factor for cardiovascular disease as well. All right? Smoking has been associated with, of course, lung cancer. But don't forget that anything in the respiratory tree, from the mouth to the tongue to the nasal cavities, larynx, pharynx, are all associated cancers with smoking. Also, the esophagus, liver, stomach, pancreas, kidney, bladder, cervix, even leukemia have all been associated with the effects of cigarettes. So this is the one most important thing we can do is get our patients to stop smoking. The physical exam is an important tool in the prevention and early detection of cancer. Right? We're very hung up on doing the tests and the x-rays, but don't forget a general physical exam with palpation of the thyroid, the testicles, the ovaries, the lymph nodes, inspection of the skin and oral cavity, all go a long way in finding small and treatable lesions. We need to talk to our patients every visit about tobacco. We need to talk to our patients about diet, exercise, weight loss, nutrition, right? We need to talk to our patients about risky behavior, such as unprotected sex that can lead to HIV and hepatitis B, okay? We need to query them about their hobbies and their work life to understand if they're at risk for any asbestos or any danger from the workplace, okay? The breast exam should be learned by all patients, and every woman over the age of 40 should have yearly breast exams by their physician, as well as mammography done to look for the early detection of breast cancer. Okay? Certainly there's other modalities now to look at the breasts, including MRI, but mammography remains the standard. Okay, every year. Men should be taught as teenagers how to do a self-testicle exam, as testicular CA is common even in young men. A skin screening should be done annually to look for suspicious lesions, right? And this is a good time to emphasize the use of sunscreens with the patients. Okay. For cervical cancer, Pap smears should be done, right? When to start Pap smears? Pap smears should start at age 21, or if the patient is sexually active before the age of 18, should be started 3 years after the beginning of sexual activity. All right? All right? All right, that should be done every year. Slightly older women, 30 and up, every 2 or 3 years is the recommendation. All right? And now, for cancer, we also have a vaccine for the human papillomavirus, right? And that can be given from age 9, recommended up to age 26, and it's most efficacious if given before the woman becomes sexually active. This vaccine is active against 4 strains of the human papillomavirus, so even if the woman is sexually active already, it's still worthwhile giving. Okay? All right. For endometrial CA, certainly the history is somewhat important, and you're going to ask patients about postmenopausal bleeding as well. What about colon cancer? Completely preventable almost all the time. The natural history of this is that the patient has a polyp, which is non-cancerous, and then it undergoes malignant degeneration and becomes adeno-CA or colon cancer. So if we could find those polyps before they turn into cancer and remove them, we've potentially saved a life, right? And certainly prevented a lot of suffering. So how do you screen for colon cancer? Certainly by age 50, everybody should be having yearly fecal occult blood testing, right? Even better is fecal occult blood testing and flexible sigmoidoscopy, right? Right? Even better than that is colonoscopy, where the entire colon is visualized by the gastroenterologist, and any suspicious lesions can be noted. And through the colonoscope, any polyps, well, many polyps, can be removed at the time of colonoscopy, and no further surgery is needed because it's removed through the colonoscopy. Okay? You could still do barium enema of air contrast, but that is falling out of favor. With the colonoscopy, you can see the problem, directly visualize the problem, and treat the problem all at once. All right? Which one of these are better? Unfortunately, this seems to be, which one the patient gets seems to be driven by healthcare economics. Certainly by straight, what's the best care? Colonoscopy sees the entire colon, whereas flexible sigmoidoscopy only sees part of the colon. Now, age 50 might be too late to start looking at the colon for some patients, right? Certainly, if the patient has a history of a polyp or a cancer, you want to do it earlier. Certainly, if a patient has a first-degree relative with colon cancer, you want to start doing colon cancer screening earlier, especially if that relative had the diagnosis at age 60 or less. Patients with other conditions that make the patient more prone to colon cancer, is very important to do screening earlier. Those include inflammatory bowel disease, familial adenomatous polyposis, and other hereditary conditions, right? So in these patients, you want to do it earlier. If a patient has a first-degree relative that had cancer, colon cancer at 40, I would start doing colonoscopy at age 30. You know, pick a whole 10 years earlier than the family history suggests they might develop cancer. This way, you have plenty of time to find the polyps and remove them. Okay, let's talk about prostate. Let's talk about men. Okay, digital rectal exam every year over the age of 50, right? And also, following the prostate-specific antigen, the PSA is very important to search for this treatable disease, right? Now, if you find out that your patient has had family member has had prostate cancer, if you find out that your patient's family member has prostate cancer, you go ahead and do the PSA at an earlier time. Okay, starting at age 40, perhaps. For lung cancer, there's no hard guidelines. There's no hard rules about what tests to do or not to do. Certainly, if you are concerned about lung cancer, a chest X-ray is indicated. Will CT scanning of the chest show pulmonary nodules and lung cancer earlier than chest X-ray? The answer is absolutely yes. There's no firm guidelines yet established as to when CT of the chest is indicated versus chest X-ray versus just the clinical exam. So this is a case-by-case decision. If they ask you this on the board, they will give you some other board tests. They will give you some other information to help you guide your decision. Certainly if there's a strong family history and the patient's a smoker, and one of the choices is CT of the chest to look for pulmonary nodule, what I would do is I would say that CT scan is the most sensitive test. If they're asking me what's the best initial test for lung cancer, you'll do a chest X-ray first and then follow up with the CT scan. So let's take an example. Here is a 39-year-old woman, and she has many sexual partners. And she has a family history of dad having colon cancer at an early age and mom having breast cancer at an early age. And let's assume this 39-year-old woman has not been to the doctor since high school. The question I pose to you is, what cancer screening tests does she need? Okay? Don't forget about cardiovascular stuff for a minute, just cancer here. Well, the answer is, first of all, she needs a thorough physical exam, right, of her skin, of her thyroid, of her lymph glands, of her breast, of the belly, of the genital urinary system, and of the cervix, right? She needs to be counseled about smoking and sunscreen. She needs to be counseled about practicing safe sex so she doesn't get human papillomavirus if she doesn't already have it, right? She has to be taught about self-breast exam, okay? Then she needs the specific screening tests. So what does she need? Well, for breast, she needs mammography, right? For colon, she needs, well, I would do colonoscopy. Dad has a colon cancer at age 43. She's 39. Okay? For cervix, she needs a pap smear. All right? She's a little too old to get the HPV vaccine. That's indicated up to age 26, so she would not be a candidate for the vaccine under the current indications. Okay? And the cancer screening case will be something like that. They're going to give you a case, and they're going to say, what tests do you need? Thank you for listening to me. That's the end of the cancer screening section.